Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We're dental practice brokers. We just got back from a fabulous Asian cruise. They want to use that area of the country or Australia in 2028 for a great seminar on continuing education. As you know, we are now accredited with the Academy of General Dentistry to give continuing education credits. But anyway, today's topic is, under what circumstances could the seller of a dental practice's attorney negotiate directly with the buyer? We'll get into that. As you know, we now have 10 employees. We're in 25 states and we work every day except Christmas and Easter. So please call us. We're always available at 201-663-0935. And we'll be more than happy to chat with you, give you some free advice or whatever. It's sunny out. Excuse the sunglasses, but wow, New Jersey is a sunny day here. All the information you're about to hear, once again, is for entertainment purposes only, not legal advice. So if you also, while discussing these topics of selling a dental practice or buying, if you have a large practice grossing over $1 million, 4 or 5 operatories, willing to stay on 5 years about, a little less maybe, you could be a candidate for a DSO. We're not employed by them, we're independent, but if we think you're a candidate, we may pull one of them in. They'll often pay our commission, so it could work out real well for you. So give us a call, we'll explain everything, how that works. In addition, if we're representing you and the practice is over $1 million at successful closing, we will often reimburse your legal fees upon successful closing. So give us a call on that. We'll be happy to talk to you about that. But we'll reimburse your fees based on some minor criteria, such as you must have an outstanding dental attorney representing you. Anyway, let's get into this now. We have a situation, this is actually happening. The buyer refuses at this point to engage an attorney. We're at, he's delivered the letter of intent. We're negotiating on the letter of intent, getting the framework together for a contract. So there's some back and forth going on now. However, the buyer will not engage an attorney. The seller has a great dental attorney already. But the buyer just doing emails back and forth and making comments without engaging the use of an attorney. Huge mistake. Huge. All right? But now, we don't know upon which time. Don't forget, the buyer does not have to, is not mandated to have an attorney. It's foolish not to have one. You absolutely need one, but it's not mandated to have an attorney. A closing can occur with only one attorney that is representing the seller. Ill-advised, should never do it. So we have a situation, the buyer is prolonging. I guess the buyer is trying to save money. I don't know. It's going to be the same money in the end anyway. But the buyer's doing something that he will not engage the attorney at this time, because we're at letter of intent and negotiating terms of the letter of intent to be used for the contract. So what's going on? At one point, if the buyer's not going to get an attorney, we want to get the deal done, the seller's attorney has to negotiate directly with the buyer. Now what happens is the buyer signs off that he does not have legal representation. It's not in his best interest to proceed without representation, and the attorney, the seller's attorney, will have him sign off on that. So he understands the jeopardy maybe putting him in, but he's not mandated to have an attorney. Now, the negotiations have been between the buyer, seller, and the seller's attorney have been going on by email. So it was time that you've got to get on the phone sometimes and share your feelings back and forth, whoever is the negotiator. And we were at that point that the seller's attorney said, look, let's get him to sign off that he has no representation, and I'll deal with him directly. And that's what's going on now. Finally, we're getting traction. Finally, this seller, because some of the percentages, I don't know what the buyer came up with, the percentages of allocation. I don't know where he came up with that, or she came up with that. But they were simply wrong. It's not the marketplace. The marketplace is not those percentages. The buyer just keeps consisting. So it wasn't until the buyer got on the phone with the seller's attorney, of course after he signed the release form and all, it wasn't until then that the buyer began to work, wake us up. Basically woke up, his eyes opened, and it's with that verbal contact back and forth. And the attorney said, look, I've done hundreds of closings. I know what I'm talking about. So what happened later was interesting. The buyer finally got an attorney to represent them. Fortunately, it was a dental attorney that I'm aware of. And that dental attorney had worked with the opposite seller's attorney many times over. So it worked out really, really well. And now the two of them are communicating. But there was a point that they were not, the seller's attorney was frustrated. Said, this buyer just doesn't understand the language here. It's when the buyer brought in a well-established dental attorney that they were able to make headway. You can't waste your time trying to save money on legal fees. Just a waste of time. Focus on getting the deal closed, because you can have another week or 2 or 3 weeks ahead of time, that is close earlier, and get the productivity. That is to make the money from the practice. Well, this is something that should happen. You've always got to keep your eye on the target. Figure out when you're at that point, even though I know you have this great job and you're making money there anyway, but figure out at one point, if you own the practice, what would be your net overhead? How much is it costing you per week by not having that practice? Okay? Average practice can close in 45 days. Usually it takes 4 months, somewhere around there, 4 to 8 months to sell, but it can easily close in 30 days. If everything's aligned, everybody's working together, even less. So that is the lesson. Get the attorney on board. Yes, you can go to a certain extent, you can move forward without an attorney, but you really need one in the end. And you need a dental attorney because they work together with each other. All right? So that's the answer for that. Thank you so much for listening. Bye now.